Visiting with us now is Deanna Aftab Guy, Dr. Guy, I should say, who is a pediatric endocrinologist and also the medical director for clinical services at UnitedHealthcare. So nice to meet you and visit with you today.
Thank you. It's great to be here.
Let me start off this conversation just by saying that I understand, and these are big statistics, everyone, but 30 million Americans actually today have diabetes, but only 1/3 of those people know that they actually have diabetes. So this is a really important program for so many people to make them aware of exactly what it is. If you can define diabetes for everyone, please.
So diabetes is a state of health in which your blood sugar is higher than normal. And that's just a simple way to describe it.
Just that feeling of like, I need food. I mean, is that similar to what we're talking about? Because people have that all the time, but you shouldn't be concerned with just that, obviously.
Now, they tend to have other symptoms, and it's gradual. It doesn't just turn on in one day. So they may feel not themselves. And as the blood sugar rises, they may not feel like they have enough energy. They may be losing weight. They may have a rapid gain in weight. They could be urinating more, feeling nauseated, frequently sick. And a lot of the symptoms don't necessarily tell you diabetes when you think about them.
All right, there's type 1 diabetes, and then there's type 2 diabetes. Can you kind of talk about those and tell us what the difference is?
Yes. Type 1 diabetes we used to think of only occurring in children.
Okay.
Type 2 diabetes we would tend to think of our grandparents, adults, older folks. Well, each of them now is crossing over into the age groups. Oh. And you can see type 1 diabetes in adults, and you can see type 2 diabetes in younger and younger children, adolescents. So it's not necessarily age restricted. Type 1 diabetes is due to when our body does not make insulin any longer. Insulin is the hormone that our body makes that helps us manage our blood sugar. It's made by the pancreas. It's the only hormone we have to help us lower our blood sugar. So you can imagine without it, we would be in a lot of trouble.
Yes.
And our blood sugar would rise and not get into the cells where it needs to go for energy. Type 2 diabetes also results in an elevated blood sugar, but it's because we don't make enough insulin. So it's there, but it might not be working for our body's needs. We tend to look at those patients as being resistant to the effects of the hormone. It could be a combination of their genetics and being overweight, where the body's needs have now changed and the insulin can't work like it used to.
I mentioned how many folks are diagnosed with diabetes here in America, but tell the viewers why they should be concerned with diabetes in general.
Well, diabetes itself makes you prone towards other health problems. Coronary artery disease, clogged arteries, heart attacks, things that are related with that, and strokes. If you have diabetes, you have a 3-time risk of having coronary artery disease and strokes compared to someone who does not have diabetes. And that's frightening.
Absolutely.
The other thing is high blood pressure. It sounds so simple, but if you have diabetes, you have a 1.5 time increased risk of having high blood pressure if you have diabetes. So these are 3 important things: heart disease, stroke, and high blood pressure, which can lead to other problems down the road.
Dr. Guy, you mentioned some of the symptoms that you would have to sit there and evaluate yourself if you were having some of these things, to talk with your doctor, is this diabetes? Can I get tested for this? But let's talk about some of the risk factors, if you can break those down for viewers as well.
True. So there are some things we can't control, and that's our genes. So it's very good to know your family history so that you can watch your health well with your doctor in order to decide if you're at risk for diabetes and to watch to see if you're developing it and to maybe prevent it. The other things that we can control are the factors sort of outside our body, our lifestyle. And a sedentary lifestyle in which we are not exercising and moving our body as we should can contribute to a risk of type 2 diabetes. Also obesity, which is interlinked with a sedentary lifestyle, and our diet. And if you already have the genetic tendency to have diabetes, particularly type 2 diabetes, which is linked with obesity and sedentary lifestyle, you probably need to be more careful and attentive to these areas and work with your doctor to prevent them from occurring.
You mentioned that type 1 diabetes and type 2 diabetes are now being diagnosed in both adults and children and kind of overlapping each other. You specialize in pediatric diabetes. So explain the difference of how a younger person would deal with diabetes than an adult.
True. Well, when you have a child, you also have their parent or their caretaker and their family and their school and their babysitter and their grandma. So you're working with a team, even though adults should have a team too. So you bring a child with newly diagnosed diabetes, they're frightened. Sometimes they can't even speak for themselves. You can have type 1 diabetes as young as in the newborn age. So it's very important to teach not just the child once they're able, but also the parents what's important to take care of their diabetes. Checking blood sugars, letting others know when they're not feeling well, keeping their doctor's appointments, taking their medicine, insulin, when they need to, and monitoring their illnesses around their diabetes.
All right, getting that help for the child is obviously essential. But as you said, you feel like the adult should almost have a team. When you are diagnosed with diabetes, how do you, as an adult, manage it? I mean, because there's a lot of steps that you have to take to be able to keep it in control.
There are. I think arming yourself with a good physician and keeping in contact with them is critical. Not just your primary care physician, you should probably also have a diabetes specialist working with your primary care physician. A nutritionist is helpful, and often they're based at your doctor's office, or sometimes your doctor can refer you to one. A foot doctor to help check your feet periodically because there can be complications. And then having your doctor direct you to specialists that are needed depending on where your health goes around your diabetes.
All right. Diabetes is obviously prevalent here in Tennessee and in other states. Do we know why?
This is considered the diabetes belt, and there are about 15 states in which diabetes is much more prevalent compared to other parts of the country. It's felt that 8 in 100 adults in the state of Tennessee have diabetes, compared to probably about 5% in other states that are not in that belt. The most common thing in those states, including Tennessee, is a sedentary lifestyle and obesity.
All right. Let's talk about if there is a cure for this condition.
That's something we strive for every day. And parents of children with type 1 diabetes know this to heart. Adults don't realize, but the research is geared towards it. There's no cure for type 1 diabetes yet, but I bet there will be, and I know they're coming closer. Type 2 diabetes can improve to the point where you won't need medication anymore. So in a way, it's treated and improved significantly. It may always be there, and you may always be at risk for it. Type 1 diabetes is not curable yet, but is very treatable, and children and adults with type 1 diabetes can live a very, very healthy lifestyle with the treatment that is available right now.
And also very important to point out is prevention, obviously. You know, you mentioned a couple things, but can you tell folks the most important thing to keep in mind when thinking about preventing diabetes in your family?
Oh yeah, well, knowing your family history, having a primary care physician, and knowing your risks, weighing yourself and understanding your weight and your lifestyle with your doctor, and compare that to your health and what's healthy for you to start doing. Do you need to involve exercise, change your diet, quit smoking, control your blood pressure, things that you can control, your cholesterol.
All right. Dr. Guy, thank you for your time today.
Thank
Great
you.
information.
Thanks.